So yes, now a quick progress report and future plans from myself, with Robert, our chair, and Azim, our treasurer, joining as well. It's been quite a big sort of 18 months or so for me and for Fifth Sense. Just to recap to what I said at the start, I started Fifth Sense back in 2012 with Carl, with basically an idea and a blank sheet of paper and a vision, okay, to create an organisation that would provide support and information to the people that I never had, okay, and wish I'd had, so that others in future wouldn't go get the same, the shrug and the same lack of information and knowledge that I suffered from. And also create an organisation that would transform the way that smell and taste disorders are understood, treated and researched. And I also had this sort of dream along with that of, well, can I build this? Can I invest my time in this and build it to a point where we're able to get funding and I'm able to potentially become the chief exec of the charity and be paid to do it full time? Well, beginning of last year, that dream became a reality when I applied for and was interviewed for and then offered the job of Fifth Sense's first CEO. And after basically 10 years of doing it in my spare time, and basically what had become almost like sort of professional schizophrenia, with effectively it got to the point where it was 2 full-time jobs, I suddenly found myself with, finally the time to focus on doing this properly. And it's been a busy old time. A lot has happened in the last sort of 18 months or so. As you heard earlier, I've recruited an absolutely brilliant team. And we've won nearly the best part of £500,000 from the UK's largest gas distribution network that's supporting our work. And yeah, it's been a busy time. What have we been doing? Well, as you know, as you heard from Mags, we've providing direct support information to people affected by smell and taste disorders, whether that's through emails, calls, in-person get-togethers that we're starting to do more of, and also the Let's Talk Smell and Taste events. Increasingly, a body of education and training for public and professionals. We've now delivered training to, I think, around 40 NHS post-COVID services that have told us that they believe, okay, that this education that we're doing should be given, most of them are saying that it should be given to all healthcare professionals. On the back of that, okay, I have been working with my MP, Victoria Prentice, who is also MP. Fifth Sense is notionally based in her constituency, and we have written to the Department of Health and Social Care and told them about this is a huge issue. These are what people have faced during COVID, lack of information. This is what we've been doing for the NHS for nothing, okay, to bring them up to speed. We want you to get this issue onto training for all health and social care professionals and fund the development of an e-learning programme which can go onto the NHS England e-learning platform. Received a rather dismissive response, it's fair to say, from a minister on this, but we've written back to him and we're waiting for a response to that, but we're working on it, and we'll get there. It's it's a long road. But there's lots going on. In the meantime, the work that Helen's doing, we are, the Stroke Association, we've done work with the Metropolitan Police, increasingly working with the Fire and Rescue Service. And again, it's this message and this emphasis that we've got on safety, okay, and actually how that's just a key to unlock so much. Because when you start talking to people about research that we've done that have demonstrated that some of you may have completed our smell safety survey that said that over 30% of people with a smell taste disorder say that they've had at least one gas safety scare at home in the past 5 years. It's a really difficult thing for people to argue with, and of course people have never thought about it before. And all we keep hearing over and over again is, do you know what? I've never thought about this, but this is really important, and we want to work with you. So momentum's gathering. And more people are hearing about what we're doing and want us to work with them. And then there's also the research side of things. You've heard obviously those brief snippets today with, as part of Carl's talk on the Research Hub from some of the researchers we're working with. There's more going on, there's more happening. Also mentioned there about the strategic engagement with policymakers, the commercial and third sector. I've already mentioned how we're engaging with the Department of Health and Social Care, but also we, last year, when Morrison's changed took the dates off milk, and I wrote to Morrison's to highlight the concerns of many of us, to say, well, what it's all very well saying use a sniff test, but what if you can't smell? And that led me to having meetings with the Food Standards Agency, and the Food Standards Agency subsequently changed the guidance on their website around use of a sniff test, and there's been no further instances of any company telling people to use a sniff test since that, because we've got the Food Standards Agency telling people, on our behalf. So it's like people are listening and people are acting. And we've talked about it already, but I'll say it again. What has been, alongside all the hard work that we're doing, okay, COVID has given us this platform on which we're building. Okay, because all of a sudden, the issue that we had, that Carl and I had for so long, okay, was that no one knew it was a thing and no one cared. Now, all of a sudden, everyone has either experienced loss of smell for a short period or knows someone who has, or has experienced it for a longer period, or maybe still. People know it's a thing now. And that is just making things so much easier in terms of, the work we're doing with the NHS, the conversations we've been having with, senior people at the NHS, that wouldn't have happened without COVID. So, we're really building on this. And alongside that as well, I put that at the bottom, sustaining, developing and growing the charity, okay, working hard to identify further sources of funding, okay, because, we've done really well with the Cadent funding, all right, but that's 3 years, and we need to bring in more. We need to generate more income. Because, I hope what's come across today is the breadth and depth of the work that my team is doing. But there's only 4 of us. We're doing amazing things. We're doing a lot with very little. But we need to be able to do more. Just quickly, in terms of looking ahead, and I want to talk about the change that we're driving, and this links into what we've just been talking about with Graham and Andy. Okay, our message: it's time we talked about our sense of smell and taste. People are listening, but we need them to do more than listen. We need to effect change. So we want to, working with the ENT profession, ensure that in future everyone in the UK has access to a specialist smell and taste clinic that needs one. And there's work that we can all do on this in terms of lobbying our own local hospitals and trusts and saying, why haven't we got a specialist smell clinic? Why am I having to sort of get a referral to a different part of the country to a clinic because there isn't one for me locally? That needs to change. We also want to ensure a key thing, and I'm making this a sort of a personal mission as my role as CEO. Over the next few years, we want to ensure that we get to the point where smell testing is routinely undertaken in all public health settings, and also, like Graham said, on the high street itself. And we'll get there. We're working with, we've now got Cadent. We've developed these scratch and sniff gas cards with Cadent that have got the smell of gas imprinted on them. We've got the Fire and Rescue Service using these in different parts of the country when they go and do home safety visits in people's homes as a way of quickly identifying if someone might have a problem with the sense of smell. Because let's face it, all right, it's not a clinical test, it's not meant to be. But if you can't smell the smell of gas on a scratch and sniff card, I can't smell anything. Well, chances are you're not going to be able to smell if it's coming out of your cooker. So it's instances like these and the data and the things that we can gather from that we can use in our arguments to policymakers in order to start getting smell testing more routinely done within healthcare settings. Also mentioned on there about the widening access to education and training. So we're working on plans to develop e-learning tool for health and social care professionals, as I say. We've also just started a project with one of Carl's students around looking at medical schools and seeing what information on smell and taste disorders is currently on the curriculum of the different medical schools around the country, and looking at, can we design a sort of a small, even a small intervention at this stage that could be taken up by medical schools. And then, you know, a key bit of this is the funding for research and more research, because we need to build a research infrastructure and landscape in the UK around smell and taste that is currently lacking. There's some great work being done, and obviously Carl's, you know, the leader in his field, and with the work that Rhino's doing, we can build on this and we can attract more into the game. And, you know, there's all this, okay, this is all ambitious stuff, but I believe it will happen. It won't happen quickly, okay? But seeing what I'm seeing and feeling that there is this sort of momentum really starting to gather, and I think we can achieve all this. At which point, I'd like to invite Azim, our treasurer, up to say a few words. I've obviously talked a bit there about the current work of the charity, plans for the future in brief. Azim's going to quickly talk about the current financial situation of the charity. Thank you.
This is subject to independent examination because we've only just finished the financial year, which ended in July 23. And as you can see, from the small start, we had income of almost £200,000, expenditure of almost £180,000, a very small surplus, and very, very strong reserves. We've got £136,000 in our reserves, which is a great position to be in. It's partly because we've got the guaranteed funding from Cadent. That lasts for another year and 9 months, beyond the end of this coming financial year. So we've got time to raise new funds from other sources. But the critical question is, all of that is project-based funding. So we get money to do a specific job. Once that job is done, we've got to find a new project and find new funding for it. So the £190,000 comes partly from Cadent and partly from the tail end of the National Lottery Fund that we earned a couple of years ago. That one's coming to an end. We've got Cadent funding in place. What happens when the Cadent funding is over? The challenge for us, and the challenge for everybody in this room, is to start fundraising independently of that. Of that £190,000, less than 10% comes from donations and ad hoc individual fundraising efforts. That's what we need to increase. That's down to all of us in the room. You know, we've all got, in our local communities, we all start to know more people who are affected. Sorry, I'm not holding the microphone very well. And so the target and the mission, if you like, should you choose to accept it, is we want to build this up to 30% of our funding over the next 2 years, so that when the Cadent project comes to an end, we have a much stronger base of funding coming from independent of any individual funder. So that's what the thought I'd like to leave you all with, right? We want everybody to start thinking about how can we raise money, how can we get awareness up, and it's back to volunteering, setting up things independently to raise money, individual donations, and let me leave you with that challenge. Thank you very much.
Hi, good afternoon everybody. First of all, may I start with an apology. I'm going to have to dash by 5:05 to get the train back to London at 5:30, so forgive me. I prepared some points to share with you, but as the day's gone forward, I found it really stimulating and really informative, so much so that what I was going to say isn't quite right. So I'm going to change it now and talk about these points here, if I may. If I get lost, you know what went wrong. I scrapped what I prepared. Here we go. So first of all, the role of the board. Well, you've met the trustees now. So we heard from Debs earlier, we've heard from Azim from Finance, and you know Carl very well. I joined as a trustee and then became chair when Duncan became CEO, but I joined as a trustee a couple of years ago. Why did they bring me on? Well, I used to work for another charity full-time, and we were driving research and better care, better diagnosis, better support, promoting independent living for people, and putting that charity, it had lost its way a little bit, I guess, and I was determined, and the board were determined, to put it back in touch with its membership, people with the conditions. And I met Andy and Graham, who are now Rhino Therapeutics staff. I met them as the charity I was with. I'll tell you, Muscular Dystrophy UK, we were funding some really important research at a number of specialist centres, and I met Graham and Andy through that work. And so what I wanted to say first then about the board is we've got a strong board with really good people who you've met today, driving the charity forward with first-class staff, who you've met as well today, led by Duncan. So the charity, I would say, is in good hands. What does the board do? Well, we're responsible for strategy and direction, but also for challenging the staff at times, supportive always, but there's a challenge at times. And we carry the can, ultimately, if things go wrong. If the charity were to be found to not follow the law, not follow best practice, the buck rests with us. So that's what we do. It's an important job. Strategic priorities, I think you all know what they are. Research looking for effective treatments, disease-modifying drugs, better healthcare, better support, but also information and support for people living with the conditions. That's really important. And what's come through today for me is the importance of partnerships. And as we drive research forward, we're going to have to work in partnership with the NHS, with the scientists, with the regulators like NICE, the MHRA. We're going to have to work with NHS commissioners. So that's really important for us. Then you say, well, what are the limits to this? What holds us back? And I think we've heard from Azim and from Duncan. In a sense, the limiting factor is lack of funding, isn't it? The lack of money to drive the staff base to do the work that needs to be done across the whole country. It's really important that we find out how. We know what to do. It's important that we have the resources to build the fighting force, if you like, that we need to drive the changes that will improve services and support and will improve research. We're quite a small charity, aren't we? We saw the income figures. I think Azim said best part of 200,000 last year income. Excuse me. Other charities have an income of 100 million, 200 million turnover. Huge national charities. And there's a sense in which we do want to work in partnership, but also they are competing. They're competing for the attention of NHS commissioners. They compete for government time, for MPs' time. So we, through Duncan and the team, need to find out how we're going to get our case across to those people. It's a major challenge, but we're up for it. And we know how to do it. It's not that we don't know, it's we have an emerging strategy, an emerging policy. Why is it emerging? Because we face new challenges all the time. As we face a new challenge and a new barrier, our fallback position is we don't take no for an answer. We keep on pushing, we keep on fighting. And if one door closes, we'll find another one to open, to push through. And that's what I mean by the emerging strategy. We keep on going, don't we? The job is too important not to be persistent. We have to keep going. I think that's all I really need to say now. I'm sorry I can't stay to talk further or to take questions, but I'm going to hand back to Duncan. Thank you all very much. Oh, I have two more things to say, sorry, forgive me. One was to thank all of you for all that you do. Second, to thank the speakers we've heard from. Brilliant speakers, both from across this country and internationally. And again, to thank the staff, excuse me, Duncan, for all the work they do. Thank you all very much. Thank you.
We're just going to do a quick celebration now, and thank you to our volunteers and fundraisers. And Sarah, microphone?
Yeah, microphone. I'm going to be 2 seconds. I would encourage everyone, which you've already done, to become a volunteer. Because these forms are on your tables. It'd be wonderful if you could sign up to be a volunteer. It does make a huge difference to us. And I'm going to be really quick because I have got, she's hidden herself behind somewhere, Glynis, who is an existing volunteer, is just going to go up and give you her experience of being a volunteer, which hopefully, I hope you encourage everyone to. And Glynis is doing a fantastic job. She's one of our, she's our smell safety champion, goes into the community.
Okay, thank you. Like some of you I've already spoken to today, I'm an Osmic after losing my sense of smell 5 years ago with a head trauma. I stumbled across Fifth Sense on one of my many forays onto the internet trying to find if there were any cures or more information, because I certainly got nothing from my GP and even nothing from the consultant after an MRI scan. I had initial discussions with Duncan, which was just fantastic, and I can't tell you how much the information and support was really useful. I think it was because of that I decided I would like to become a volunteer as well. Although I volunteered to help in March 22, very little started during the first year, and I have to say I was a little frustrated by that. But having spoken to Robert and then began to understand what a small charity Fifth Sense actually was, I realised that how on earth had Duncan, and at that time just Sarah, managed to do all the good work they had without particularly any help and very little funding. So some of the things I have started to do, just to let you know, is I took part in some of the research with the trial machine of Professor Phil Potts in London, within the University of Central London. And I've also been concentrating on sort of putting tangible and visually locally visual information out. I know there's a lot of people doing stuff on social media, so I thought I would look at what we could do with actually leaflets and posters. So I've been posting leaflets on notice boards in public areas, such as libraries, town halls, supermarkets and pharmacies, that sort of thing. And I've been feeding back to Mags all the time about what works and what doesn't. I found that individuals can initially be quite supportive about advertising Fifth Sense, but then you find that policy has decided that they'll take all the information off their board every month and refresh it, or actually a notice, a poster has disappeared, and you don't know whether it's because somebody actually has taken it or it's just been cleared off. I had quite a good working relationship with my local pharmacist, who was really keen to sort of promote Fifth Sense and hand out the leaflets. But they were taken over about a month ago. So next time I went in, there was no posters up at all. So I spoke to the new pharmacist, and they weren't at all keen about advertising them. I tried to persuade her, and then hopefully she said she's taking some leaflets and she may put them up. I've spoken to stall holders at the Good Food and the Garden Show at the NEC, and I've passed on contacts to Duncan, who are sort of interested in helping and being ambassadors for helping people with different food ideas. I've been in touch with a contact who works for Cadence, or a subcontractor of Cadence, to also hand out leaflets when they go around. And he's promised to talk to his customers with a batch of leaflets. But again, getting feedback is quite difficult. I can't sort of keep ringing him up every week and say, oh, have you handed out more leaflets? You know, what did people say? I've been discussing lots of ideas with Mags, and hopefully, well, as you probably know, they're working on slide packs, and Helen has been doing that, so that they can be used to talk to people in different groups. I'm keen to run an article in our local paper to set up support groups, but obviously I know that can't really go ahead at the moment until there's a better infrastructure in place. So I feel my forays have been useful. At least it's been finding out what works and what doesn't. But at the moment it's probably B for effort, but a questionable C for achievement. But as my teacher would say, well, it's probably a good start. So I would encourage you, please become a volunteer, but don't expect to have something to do next week, because there's a lot more work to be done, and obviously the team are doing a fantastic job. Thank you.
I just wanted to thank Liz. She underestimates what she's doing. Just one person going out and doing this does make a big difference. So it's really vital people understand how little you do. It is really important for charities. But charities like us, where there are only 4 people, we work flat out all the time trying to make a difference. So the more volunteers we have, the more powerful our voice becomes, because all of you as volunteers have the lived experience and can tell people exactly what it's like to live without a sense of smell and or taste. Thank you very much anyway.
Yeah, because this is really important. You know, we don't currently have the sort of resource to sort of, you know, have a nationwide volunteering program with hundreds of volunteers. We'd like to, okay, and I'm hoping we're going to get there. We've submitted a funding application for follow-on funding to the National Lottery Community Fund for in excess of £200,000 over a 3-year period, okay. If that's successful, that will give us salary costs for a community development officer, and they'll be responsible for delivering and rolling out a social action program, okay, which is going to be based around bringing people together in groups around the country to provide support to others, so peer support, local education, outreach, engagement activities, fundraising, you name it. We had very, very positive feedback on the first round submission, and so they invited us to submit a full application, which we've done. I made some tweaks to the application the other day and sent it back to them because they asked for a bit more information, and you know, all very positive. And I was hoping we'd get an outcome before the conference, but hopefully it's going to go to November's funding panel meeting. So we'll hopefully have an outcome at the beginning of December. So please keep your fingers crossed, because this will be a really big achievement if we get it, and it will give us, as Glynis said, the infrastructure that we need to really grow and build that volunteering program. Because together, okay, and this sort of grassroots activity on the ground, going into places, talking to people, this is how we can make change. You know, we and the team can do a lot, but together, you know, all of us, we can achieve so much more. I'd just like to say a big thank you to our fundraisers. Firstly, Rebecca Mitchell, who those of you who were at the last conference will remember. Rebecca was there then. She's not able to come along today. Rebecca has no problem with the sense of smell at all. She's a wine educator and sommelier who found out about fifth sense from researching on the internet and contacted us because she said, I really want to get involved. This is a really important issue, and I can't imagine what it would be like for me if I was to lose my sense of smell. I wouldn't be able to do my job anymore. Rebecca's absolutely fantastic, really passionate, become a really passionate ambassador for fifth sense and smell and taste disorders. And she led our first proper fundraising event at the end of April, which was a wine tasting event in Exeter, where she's based. And she got people that led the tasting of the first 3 wines, each one from the perspective of someone with a smell disorder. So the first one was anosmia, then parosmia, and then phantosmia. And the way that she talked people through it, it's like she had the experience herself. And basically, because that's from the work that she's done with us, that's from the events she's been to, hearing other people's stories, and she's got a really good understanding now. And you know, we can do more of this. And we've got more and more people from the fragrance and food industries interested in getting involved. And again, that's something that the lottery funding will support the rollout of. So yeah, big thanks to Rebecca for her hard work. And we're working together, and we're planning on doing another, potentially 3 more wine tasting fundraisers in different parts of the country next year. So watch this space. And then also, big thanks to someone to whom some of you may be familiar with, Adam Hawkins, who has Adam's like a human sort of version of the Duracell bunny. He's amazing. The range and sort of breadth of activities, endurance events and fitness challenges he's done to raise money for Fifth Sense and raise awareness of a particular cause of smell loss. So Samter's Triad, which some of you may have heard of. Samter's Triad is a combination of chronic rhinosinusitis with nasal polyps, aspirin desensitivity, and asthma. It can be really difficult to treat, and obviously loss of smell comes part and parcel of it. So Adam's been raising funds for Fifth Sense for the past couple of years now, over £3,000, and also raising awareness of Samter's Triad. We need more. We need more. So this is, picking up on what Azim said earlier, I'm throwing down the gauntlet to you. Join the fundraising team. get involved and help raise money for Fifth Sense. Myself and Carl, 2 years ago, we did a 158-mile bike ride around London, which involved falling off part way, or I did, coming down a hill and earned myself a few scars. But we got to the end and raised over £3,000. Obviously Adam and Rebecca, but it doesn't have to be a big challenge, okay? It can be something really small and simple. Coffee morning, doing a cake sale, going into Christmas Jumpers Day at work, whatever. I think there's something really, really important here, because in terms of the volunteering bit and the fundraising bit, all right, by getting involved as a fundraiser and doing something, whether with your work colleagues, whether you're people in the local community, you can raise some money, but you're also raising awareness, okay? Because what is it that we struggle against so much? It's the lack of recognition. Well, if we do something in the community, at work, okay, we'll give you a Fifth Sense T-shirt to do it in, okay, and you can basically be raising awareness of smell and taste disorders and getting people to understand. We can send you leaflets, we can send you whatever, and raise some funds as well, and at the same time get more people aware of this. So, show of hands, who's up for getting involved? Who's up for doing something in the new year? Yeah, brilliant. This is great. Come and talk to me. Okay, come and talk to me and Sarah. I know everyone's got to get off, but come and have a chat before we go, and it'll be really, really great to sort of build a bit of a fundraising team for 2024, and we can really, really work together to help build and grow the charity. And also, I'd also suggest as well, anyone interested in making a donation, please have a think about making a regular monthly donation to the charity, even if it's £2, £5, whatever. Little bits of funding like that on a regular basis, that's really helpful to us, because we can start to budget against it. Because if we know we're getting, a few £100s a month from donations, that's really, really helpful as opposed to the odd, £10 here and there. So that's just a thought as well. I think really just to sort of summarise, I really hope you've enjoyed today. I think it's been a really, really, really good event, probably one of the best conferences we've had. I think this is a mega, mega, mega exciting time for what we're doing, all right? I think that we're going to start seeing a lot of change through the work we're doing in partnership, okay, with Graham, with Andy, with Cadence, with our other partners, Flavour Active, with Carl and many other clinicians, Steve, Lorenzo, all the researchers here as well. Together, we can change things, okay? And we're going to do it. Thank you all very much for coming, and thank you all very much for your support of Fifth Sense. Thank you. Thank you very much.